Hi YouTube. So I was thinking of doing sort of a pillow talk series where not necessarily talking that dirty or about sex or anything like that, but I think it's easiest to do things with my baby right up on me, and the easiest place to do that is a nice big soft surface like our bed. So I will be usually surrounded by pillows, but the topic will definitely vary. Something that's been on my mind lately is the topic of home birth. I have a number of friends that are pregnant. I have an almost 6-month-old, and we want our children fairly close together, so we're already debating, when to start trying for number 2. Not this year, I can guarantee that, but soon enough. And we had a wonderful, Jaden's right here, just outside of the screen. We had a wonderful birth center birth, attended by one of the midwives at Women's Birth and Wellness Center. And it was great. It was a water birth. Very few, there were no interventions. And there was even, our midwife was great. It was like she knew that I just needed to do my own thing. And so she popped in to take a look on how things were going and then disappeared. And I know there were a few times when I was in labor, I looked at my husband and I was like, is anyone else in the room? And he'd be like, no. And I'd be like, okay. So it was great. It was what I needed. All natural. Yeah. So even my husband, who has never fought me on my birth choices or tried to influence me at all, was like, there's no point in driving, now that he's seen it done without any interventions. He knows it's safe. He knows that midwives are more than qualified and that my body will do what it needs to do. He doesn't see any reason to leave home at all, which I think is great. So we're hoping that number 2 will be a home birth. Now, of all my friends currently pregnant and due in the next 6 months or less, I have a couple going to the birth center that I went to. One is on their first child, one is not, and then the third is having a home birth, which her first birth was a hospital experience with tons and tons of unnecessary interventions. It was like the doctor just wanted to yank the baby out so he could go back home. Which that was a number of years ago, and it's not often as bad as hers was routinely anymore, but it's not that far off either. So, just like this time, the only way I'd end up in a hospital is in the event of emergency. So, home birth here, having one friend that's doing it, trying to debate whether I want to try and visit in the process, either right before or right after, and see the setup in person, because I've never attended a home birth before. I know people who have had them, plenty, and obviously they turned out fine. But I know that there are very limited options in our area for a home birth. And one of the reasons is we have, count it, 4 midwives in North Carolina that are legally allowed to attend a home birth. 4 midwives in the entire state of North Carolina that are legally allowed to attend a home birth. 4. And 2 of them service our area. And one of those 2, her office is like 2 hours away, almost. Maybe a little less than that. Maybe I'm exaggerating. It seems like it's 2 hours away. It's definitely out in the sticks. But she will drive to this area to deliver. Now, granted, they each have assistants who are basically midwives in training, but I mean, that's just like a nurse happening to catch your baby because the doctor didn't make it 4, count 4, which just blows my mind. Like, you would think, as country of a state this is, that, you know, there would be more home assistants. Very little experience with breech births, very little experience with home births. I mean, I remember the reactions I got when I told people I wasn't going to a hospital to deliver. They told me I was crazy. And I was still in a birth center. I don't think people realize that midwives, including home birth midwives, at least in the state of North Carolina, all have to be certified nurse midwives to practice. Which means that they are registered nurses before they even attempt the art of midwifery. Which means that they can write prescriptions and attend patients, yes, at a similar level to a physician. They do not have the extensive training, but they have many of the same abilities. They just aren't usually as specialized. So a midwife is a medical professional in all states, but especially in the state of North Carolina, only the highest level of certification is allowed to practice, which is a certified nurse midwife. There are also certified midwives, which I believe don't have to become nurses, and direct entry or lay midwives, which shadow and study under other midwives and don't necessarily undergo formal schooling, and neither of the other 2 types of midwives are allowed to practice legally in North Carolina. And only the 4 can practice in a home birth legally in North Carolina. Physicians, of course, I mean, why would they even bother? Most people just default to an OBGYN anyways, or at least a practice that's mixed OBGYNs and midwives. So, there's that. I don't know, like, I don't have a lot to say about home birth. It's great, it's awesome, you don't have to leave, you've got your food, your kitchen, your house, whoever you do or do not want to be there, however many people, it's basically your rules, you know. So I have absolutely nothing negative to say about home birth. In the event of an emergency, even in the event of an emergency in a hospital, you have to hope the right people are there at the right time, and you're close enough to the part of the hospital that they want to get you into. I mean, a doctor or a nurse performing emergency care on you in a hospital, I mean, a midwife is qualified to do that as well. They have all the emergency equipment in the event the newborn is not breathing, or emergency medications need to be administered in the event of hemorrhage. They can do sutures. I mean, they just can't give you an epidural or a Pitocin drip because of the extensive monitoring that need to be done. That also kind of defeats the purpose of a home birth. So, yeah, I just can't believe that there are 4 midwives in a state with 100 counties. Not a huge state, but it's a decent sized state that can deliver home births. So, hopefully one day, I can be one of those. I've been debating on what to do after this guy and his siblings that do not yet exist are in school, and I think that is one of the things I'm looking at right now, is doing that. Yeah. So, topic number 1, home birth. It's awesome, exciting. I cannot wait till my chance, but the opportunity is rare, and it's so very frowned upon. Very, very frowned upon. I may do a follow-up video with more specifics, but, I mean, It's not like the things you need to know about a hospital birth, like, oh, they're going to give you an IV, and they're going to do this, and you have to watch out for this, and, I mean, there's almost no need for a birth plan, you know, as long as the people around you know what you want. Because you can't plan a birth. It's more like a birth suggestion list, which I actually never got to typing up and printing out before he was born. Luckily, I am pretty good at discussing my desires. So everyone pretty much knew what I wanted. It wasn't necessary. We did delayed cord cutting. Oh, are you gonna sneeze? No. Here you go. Yeah. And everything. So, yeah. Topic of the day. And I think this guy is getting hungry. All his cuteness. So that will be all for now. I'll also be trying to get back into yoga, seriously. So if we're lucky, there may be some videos of that. And I'll see you later.